Hello everyone. Today's video is about thenar muscle injury. Thenar muscles are a group of muscles situated at the base of the thumb. So the muscles can get injured by any mechanism. So once it is ruled out that it is not a bony injury, that means a fracture, then that means if it is a soft tissue injury or a thenar muscle injury, in that case you need to immobilize the hand in a thumb spica like this, keeping the thumb straight so that you prevent any movement at the thumb. The thumb spica is supposed to be worn for at least 10 to 14 days depending upon the extent of injury and the number of muscles involved, as the thenar muscles are 4 in number. So depending upon how many muscles and to what extent the injury has happened, you need to immobilize your hand. The first thing is immobilization. Second thing is keep your hand elevated so that you prevent the swelling from occurring. The third thing is you can apply an ice pack wrapped in a towel over the affected area. So you can apply this ice pack for at least 10 to 15 minutes, 4 to 5 times in a day. Then the third thing that you need to do is you can apply a Kinesio tape over the affected area. This has to be done by a trained physiotherapist or a physical therapist. So you can approach a physiotherapist who can do a Kinesio taping over the affected area. What the Kinesio tape will do is it will lift the skin and will maintain the blood circulation and will help in the drainage of the waste products as a result of repair of the soft tissues. It will also aid in lymphatic drainage. So it will help in healing. So the Kinesio tape will actually help in this process. So first is the thumb spica, immobilizing the hand for 10 to 14 days. Then the second is the application of the ice pack, and the third is the application of the Kinesio tape. So apart from this, what we need to do is we need to mobilize the joints which are free from immobilization. That is, only this part is immobilized, we are not moving. So the rest of the joints of the hand need to be mobilized so that the circulation in the joints is maintained and the strength of the muscles is also maintained. Otherwise the muscles will go into disuse atrophy. That means when we don't use the muscles get shortened. There is adaptive shortening in the muscles over the period of time. So what we need to do is we need to mobilize the joints which are free from immobilization. So starting with the shoulder joint, every exercise we are going to repeat for 10 to 15 repetitions and can be done for 2 to 3 times in a day while wearing the thumb spica. So first is the shoulder joint. You will take your hand up like this, flexion and extension. Bring it down, flexion and extension. 10 to 15 repetitions, 2 to 3 times in a day. Second is at the shoulder joint. Take your hand up, abduction, adduction, abduction, adduction, like taking the hand away from your body, bringing it down. 10 to 15 repetitions, 2 to 3 times in a day. Then the next is in the plane of the shoulder. Bend the elbow like this, and like this you will do the rotation at the shoulder joint this way. 10 to 15 repetitions, 2 to 3 times in a day. Then the next exercise is at the elbow joint. You need to bend the elbow, bend it like this, then straighten it, extend it. Flexion and extension. Again 10 to 15 repetitions, 2 to 3 times in a day. Then the next exercise is at the radial joints. That means the supination and the pronation movements. What you need to do is bend your elbow, keep your hand in the mid plane like this, and then what you do is you take your palm up towards the ceiling like this, bring it down. Do it while maintaining the thumb spica in the position like this. Don't overforce your hand. Do it as much as you can wearing the thumb spica. 10 to 15 repetitions, 2 to 3 times in a day. Then the next exercise is of the hand. The hand muscles are the most important muscles which need to be strengthened, because once the thumb spica is off, you take off the spica, the hand muscles will go into extreme weakness, your grip will decrease, and the daily activities, functional activities will also get hampered because most of the activities are done with the hand. So what you need to do is keep on strengthening the muscles which are free from immobilization, that is, which are out of the thumb spica. So what you need to do is you need to strengthen the palmar and the dorsal interossei. You need to strengthen the lumbricals, the hypothenar muscles, and the rest of the joints of the hand, so that the circulation in the hand is maintained. Now, so the first is the palmar and the dorsal interossei. So how you are going to do is, in keeping your hand like this straight, you can take the support of the bed or the couch, and now take your fingers out, join your fingers, take your fingers out like this, dorsal interossei, palmar interossei, like this. Fan out your fingers, bring them close. Fan out your fingers, bring them close. 10 to 15 times. You can do this for 3 to 4 times in the day, because you need to strengthen the hand muscles later on, otherwise the grip will really become weak. Then the second is making a hook. Bend at this joint, keeping these fingers straight like this. See, the hook, the muscles will work like this. Make a hook like this, keeping the thumb straight. Bend it for 10 to 15 times, 3 to 4 times in a day. Then the third exercise would be of the hypothenar muscles. Do all the movements of the little finger like this, of the flexion, extension, like taking it towards the palm, away from the palm, taking it out, the little finger taking it out, taking it in, like this way. Again 10 to 15 repetitions, 2 to 3 times in a day. Then, now what you will do is, imagine that there is a dot at the tip of these fingers and there is a dot at the end of these fingers where the palm is ending. You need to join these dots with these dots, imaginary dots. So what you will do is, you will bend your finger and make a hook fist like this. Make a hook fist like this, maintaining the thumb spica in position. 10 to 15 repetitions, 2 to 3 times in a day, like this. Then the next is, you make a flat fist. Now you will bend the fingers like this and will touch the palm, but the distal phalanx, the distal joints will not bend. You are only bending the knuckles at the first joint, like this. See, this is the flat fist, like this. Then the next is the complete fist, full fist, but in this you are not using the thumb. So you will bend all the joints of the fingers like this, but you are not using the thumb. Bend all the joints of the fingers like this. So this is a full fist. So initially it was a hook fist, then it was a flat fist, then it was a full fist. This will help in maintaining the strength of the intrinsic muscles of the hand, and later on when you remove the thumb spica, the muscles will not go into weakness. Apart from this, what you can do is, whenever you remove your thumb spica, so the distal joint of the thumb goes into stiffness because it is immobilized. So what you can do is, keeping the thumb in plane of the hand, you can just bend it like this and extend it. See, bend it like this and extend it. Only this joint. You are not doing any movement at the thumb, the flexor pollicis longus, only this movement. This is all about this video. If you like the content of this video, then definitely do not forget to like it, and if you have not subscribed my channel yet, please subscribe it.